this is Suprava. Welcome back to another session of Modern Concept of Childcare. In today's session, we will be starting child health procedures. So, with this session, we will be learning what are the different types of child health procedures are there. So, in today's session, we will basically learn about a procedure which is related to feeding. Can you guess? Yes. So it is nasogastric tube feeding, or we also call it as gavage feeding. So let us start today's topic, that is nasogastric tube feeding. So nasogastric tube feeding or gavage feeding is an artificial method of providing nutrients or providing fluids or medicines. So basically, this is a process of feeding with a tube, and the tube is called as nasogastric tube. So basically, this is a process of feeding with a tube, which is called as nasogastric tube, which is inserted through the nose, and then it goes to the pharynx and esophagus and finally into the stomach. So with the help of this nasogastric tube, we are going to provide nutrients, fluids, and if there is any kind of medicines that should be provided to the child, we are going to provide all these to the child. Now, why do we need an artificial method to provide nutrients, and what is the purpose of using this NG tube or nasogastric tube? So let us see what are the purposes of nasogastric tube feeding. So definitely the first one is that to feed the children who are not able to take feed orally. So any conditions which inhibit the child from taking food orally, we are going to use nasogastric tube feeding. So in any conditions where the child is incapable of taking food orally, we are going to use this method of or artificial method of feeding. Next thing is, if there is any child who is undergoing surgery or who has undergone any kind of surgery, like in case of cleft lip, cleft palate, or if there is fracture of jaw, then the child has to undergo surgery, or might be it is like the child have already undergone surgery. So in that case, the child will not be able to take food orally. So in that case also we have to go for an artificial feeding, and in that case we would choose or we would use NG tube feeding or nasogastric tube feeding. The next thing is conditions in difficulty in swallowing. So there might be children who whose swallowing reflex is not properly developed and they have difficulty in swallowing. So in that case, if the child takes food orally, they won't be able to swallow it, right? So in that case also we are going to use an artificial method, that is NG tube feeding. The next thing is when the patient is unconscious or semi-conscious. So if the patient is unconscious or semi-conscious, the patient cannot take food orally, they won't be able to swallow the food, and that's the reason we are going to use NG tube feeding. Now, there are certain conditions, like for example, severe burns, malnutrition, or in case of prematurity, or if there is chronic infection. In these things, it is not supportive to take large amount of food orally. So the child won't be able to take large amount of food orally, and in that case we have to go for an artificial feeding. So in these things also we use NG tube feeding. Now next, there are certain conditions where the patient is unable to retain the food. For example, in case of anorexia nervosa, they have when they take less food, with that their appetite gets it reduced. So what happens is they become unable to retain the food, and they also gets vomiting. So that's the reason here also we can use artificial feeding in case of anorexia nervosa and frequent vomiting. Now, these are some of the purposes of NG feeding or nasogastric tube feeding. Now, next, we should learn about what are the advantages of this artificial feeding or this gavage feeding. Now, one major advantage is that there are certain medications and food which doesn't taste good, and it is very difficult to feed those medicines or foods to children. So with NGTU feeding, what the advantage is that we can feed this the food or the medicines which taste maybe bitter or it doesn't taste good, and those things also can be fed can be so those things also can be given in adequate amount. The next thing is that it can be continued for weeks without any danger. So it doesn't have, such major danger to the child's health. So it is a very safe process of providing food to the child. So it can be continued for weeks without, having any kind of danger. Now, there might be certain incidents or certain times where we there is a need to aspirate the stomach. So, according to the need, the stomach can be aspirated at any time, and large amount of fluid or large amount of food can be given with safety. So, these are some of the advantages of nasogastric tube feeding. Now, next thing is so these are some of the advantages of nasogastric tube feeding. Now, next thing is whenever we are doing any kind of procedure or we are doing any practice, we are following any practice, we need to follow certain principles, right? Yes. So here also we have certain principles which we need to keep in mind and we have to follow when we are doing nasogastric tube feeding or when you are inserting the tube or when you are feeding the child at any of the time. There are certain principles which you should follow. So let us learn what are the principles of nasogastric tube feeding. So the first principle is avoid misplacement of the tube. Now it is very important principle as as we were already discussing that it is a process through which we provide food to the child when the child is unable to take food orally, right? Yes. So here, one thing you have to remember that the food or liquid, whatever you are providing, that should reach the stomach. And for that, it is very necessary that the tube is in right place or the tube is in the stomach. So to place the tube in the stomach, it is very important to have a thorough knowledge about the anatomy and physiology of the digestive tract and also respiratory tract. So that would ensure a safe induction of the tube because it is if you are well aware about the anatomy and physiology of digestive tract and respiratory tract, you know when to push the tube and at what pace and where to insert the tube. So this is a very important principle that you should not misplace the tube. If the tube is not placed in the stomach, that can bring many consequences. So to avoid that, it is very important and it is advised to avoid the misplacement of tube. The next principle is that you have to prepare the client mentally and physically. So here you need to understand one thing that introduction of the tube into the nostrils or into the stomach, it is a frightening situation, right? So the client would resist every attempt you make, And if you don't prepare your client physically and mentally, it would become difficult for you to insert the tube properly. So preparing your client mentally and healthily would so preparing your client mentally and physically would facilitates introduction of the tube. Now the next thing is about the size of the tube. Now, the next thing is you should never force the feeding tube under pressure. So, if you while inserting, if you feel any kind of pressure which is blocking the tube to go inside, you should hold it back and wait for some times, and then again try to reinsert the tube. But you should not force the tube inside under any kind of pressure. And the next principle is while feeding, you should elevate the patient's head, or you should make the infant sit in a semi upright position, so that there won't be aspiration of the contents what you are providing. Now these are the principles what you should keep in mind while following this procedure. So the next things to to insert this tube, to insert the nasogastric tube, or to do this procedure, we need certain articles, right? So the next thing we will be discussing about what are the articles needed for nasogastric tube feeding. So first we need a Macintosh with towel. We need a kidney tray for receiving the waste. So sometimes there might be regurgitation of the gastric contents. To receive that we need a kidney tray. We also need a cotton balls or cotton tipped applicators to clean the nostrils to avoid any kind of infection. So to clean the nostrils and to provide hygiene, we need cotton balls, and we need the Riles tube in a bowl. So here one thing comes that what should be the size of the Riles tube. So basically, children who are less than 1000 grams, for them we use 6 French of the size should be 6 French of Riles tube. And children who are more than 1000 grams, for them we use between 6 to 8 French of Riles tube. So while when you are doing this procedure, you have to make sure that you choose the right size of the Riles tube. And the next thing we need is lubricant to prevent friction. So when you are inserting the tube, it should not cause any kind of friction, and to avoid that, we are going to use lubricants. You need an adhesive tape or plaster, a measuring cup, and a sterile syringe which should be about 10 to 20 ml. You also need a suction apparatus to clean the airway whenever it is needed, and with that, we are going to keep a bowl with water. So this is basically to check the location of the tube, and then we are going to have a clamp. So this is to clamp the tube whenever we are not using it. And then at last we need a pH paper. So these are the articles that we need to do nasogastric tube feeding. Now next, let us move to the procedures. So here we will be learning about the whole procedure of nasogastric tube feeding. So for first thing, I think you all will be aware that whenever you are doing any kind of procedure, the first thing is that you have to identify your patient, right? So that is the first and foremost step. What we are going to follow here, that first we are going to identify the patient, and then we have to explain the procedure to the patient. But here, as we are dealing with child health and we're dealing with a client who is who's a child, so in that case we have to explain the procedure to the parents or to the family members, which is very important. So you need to first identify the patient, and then you need to explain the whole procedure to the family members, that what you're going to do and what is the reason of inserting the tube, and why the child cannot take feed orally. So these are the things you need to explain to the parents, and also if there is any consequences that might happen, or if that can have any complications to the child, that things also you need to explain to the parents. The next is you should maintain privacy, and then you have to make the patient in comfortable position. So first, you have to make the patient lie down in a comfortable position, and you have to make sure that the patient's head is straight. So if the head is not straight, that would not facilitate the tube going into the stomach. So it might there might be misplacement of tube. So to avoid that, you need to make sure that the patient's head is in straight position. So you can make the patient sit on a chair, or you can also place the patient in Fowler's position. So next what we are going to do is we are going to arrange the Macintosh and the towel over the patient's chest. While doing this procedure, you need to remember that you are inserting the tube into the nostrils, and the patient will have gag reflex. So you should make sure that your kidney tray is ready, because the patient, if vomiting occur, you are ready with your kidney tray. Now, before inserting the tube, as we know that we are inserting the tube into the nostrils, so the nostrils should be clear enough. There should not be any secretions deposited. So now, as we know that we are going to insert the nasogastric tube into the nostrils, so the nostrils should be clean enough, and it should not have any secretions deposited over there, right? So to do that, first thing, we are going to clean the nostrils, and if any secretions are deposited, we have to remove that out, right? So that is one thing that we would do to clean the nostrils, and then we are going to arrange all the articles near the bed. So after doing this, you have to go for your hand washing. So you have to follow the proper steps of hand washing, and think that you are already aware of. So after doing the hand washing, you have to come and insert the tube, right? So while inserting the tube, you, as we have already seen the principles, that you should not force it under any pressure. So you if you feel any kind of pressure which is blocking the tube to go inside, you have to wait for a while and take it back, and then try to reinsert it again after some times. So this is how you're going to place the tube. Now, when you are done with inserting the tube, the next thing comes is that checking the patency of the tube, right? Yes. So here it is very important to check the patency of the tube, or to check the location whether the tube is in stomach or not. So here it is very important for the nasogastric tube to be in the stomach. And if it does not reach the stomach and it goes to the trachea, it can go to the respiratory system, respiratory tract. And then what happens when you feed the child, there will be the food contents, or the fluid contents would directly go to the respiratory tract, and the patient would choke, right? So this can bring a very major complication, and to avoid that, it is always advised to before feeding the child, you should always check for the patency of the tube. So here the first question is how to know that how much tube to be inserted, right? So first thing is that we have to measure the tube. Well, so we are going to see how to measure the tube. So first we are going to take the tube from tip of our nose to the end of our earlobe, and from there the xiphoid process of the sternum, and from there to umbilicus. So we are going to place the child in a Fowler's position, and we are going to take the tube, and you have to place the tube from the tip of the nose to the end of the earlobe, and from there to the xiphoid process of sternum, and from xiphoid process of sternum to umbilicus. Now, the from the xiphoid process to the umbilicus, there is the middle point we are going to mark, and till that middle point, we are going to insert the tube inside the nose. So once we measure the tube, the next thing is we have to lubricate the tube to prevent any kind of friction when the tube is inserted, inside the nostrils. So we are going to use any water soluble or any kind of lubricant we can use to lubricate the tube, and then we are going to insert it. Now we are going to insert the tube into one of the nostrils very slowly, and we have to pass the tube slowly downwards and backwards. Now, when the tube reaches completely till the marked spot where we have marked, from the xiphoid process to the umbilicus, the middle point what we have marked, when that mark point reaches, we have to stop to insert. Now, the next thing is we have to confirm the placement of the tube. So, how to confirm that whether the tube is in place or not? So, there are different methods. So, the first thing that what we can do is we can take an empty syringe and we can aspirate a little amount of gastric contents. So, if we get gastric contents, that would determine that the tube is in stomach. Other method is we can also place the end of the tube in a bowl of water, and we have to check whether there is presence of bubbles. So if there is presence of bubbles, that indicates that the tube is in trachea, right? So this is how we are going to check the placement of the tube. Also, there is one more method that we can use, that using a stethoscope. So here we are going to take an empty syringe and we are going to blow a certain amount of air inside the tube, and we have to place the stethoscope in the stomach, and if we can hear the sound, it indicates that the tube is in stomach. And if it does not reach there, if we don't hear any kind of sound, that means the tube is not in right place. So these are some of the different methods what we can use to confirm the placement of the tube. Now, once we confirm that the tube is in the stomach, we are going to examine the mouth of the patient with a tongue blade, and to see if there is any kind of minor injuries are there, or any kind of presence of bleeding. So after this, we have to secure the NG tube. So after this, we are going to secure the tube with adhesive tape, and this is very important, so the tube doesn't move around and it doesn't get misplaced. Now, this was about inserting the tube. So once you are done with the tube, and next time when you come for feeding the child, how and what all things you should follow. So this was a procedure of inserting the NG tube. Now next we are going to see what is the procedure of feeding the child with NG tube. So from first, as we discussed earlier in procedure of inserting the tube, that whatever initial steps are there, that is definitely same for each procedure. So we will only discuss about how to start the feeding and what are things we need to follow. Well, so before feeding, it is very important to confirm the location of the tube, or to check the patency of the tube. That is the first and a very important step. So before feeding, you should always check the location of the tube, that it is in the right place, that is in stomach. And for that you can choose any of the methods what we have discussed in the earlier procedure, that is procedure of NG tube inserting, right? So here during feeding, once you confirm the location of the feeding tube, or once you get to know that the tube is in right place, the next thing that you need to do is, so next the tube will be clamped, right? So what we need to do is we need to pinch the tube and remove the clamp, and then we need to place an empty syringe over the tube. So once we place the empty syringe over the tube, and then we have to pour the solution, that is your liquid, the food, or medicines. So we are going to pour the liquid in the syringe, and till that time we have to pinch the tube, we should not leave it. So once we pour the syringe with the nutrients, we are going to release the tube slowly, and we have to so once we pour the syringe with the food or the nutrients, we are going to release the tube slowly. And before pouring the nutrients or pouring the liquids to the syringe, you should check the temperature of the food, that it should not be too cold, or it should not be too hot. So there should be a moderate temperature of the liquid or the food contents that you are providing. So once you are done with providing the nutrients or providing the food to the child, then you are going to flush out the tube with 10 to 20 ml of water, or however it is advised by the physician. So we have to flush out the tube. Likewise, if you are providing any kind of medicines, in that case also you have to crush the medicines properly, and then you have to mix it with water, and then you can pour it in the syringe, and you can provide the medicine through the NG tube. But in that case also, before providing the medicine, you should always flush out the NG tube, that is with 10 to 20 ml of water, and then after providing the medicine, you can again flush out the tube with 10 to 20 ml of water. So this is how we are going to do NG tube feeding. Now the next thing comes is aftercare. So once we are done with the NG tube feeding, after that, what all things we need to do? So here first thing, we can offer a mouthwash to the child, because that would provide hygiene, and it is very important in prevention of infection. So we have to prevent any kind of infection, and for that we are going to provide a mouthwash. Then you are going to remove the Macintosh and the towel what you were using for the feeding procedure. You have to make the patient be in a upright position, semi upright position for certain times, to avoid the regurgitation of gastric contents. So if the patient is seriously ill, or if the patient is unconscious, or if there is any kind of secretions which are collected in mouth, for that case you can provide suction, and then you can take all the articles back to the utility room, and discard whatever the waste product that you got. And here, one very important thing is that you have to do the documentation. So recording the time of the feed, date, the amount of feed, and the nature of the feed. And during the feeding, if there was any significant reaction from the patient, so that also you need to document in the nurse's note, and as well as intake and output chart. So this is about the feeding procedure. But with that, when you are done with the NG tube feeding, you should make sure that you clamp the tube. And this is very important because if you do not clamp the tube properly, there is a chance that air might go inside the stomach from the tube, and the patient would feel bloated. So to avoid that, you should always clamp the tube once you are done with feeding. And also, as we were discussing that before feeding, how you're when you're going to remove the clamp, what you're going to do. So when you are removing the tube, and when you're opening the tube, you have to pinch the tube because you should not allow any air to go inside. So you're going to pinch the tube, and then you're going to place the syringe over the tube. And once you pour the nutrients on the in the syringe, then only you are going to release the tube slowly. So this is to avoid any kind of entry of air into the stomach. In the same way, when you are done with feeding, you have to make sure that you have clamped the tube properly, and you have closed the tube properly so that air should not go inside, which would make the patient bloated. So, this was all about nasogastric tube feeding. I hope you have got a better insight about the topic. Thank you.